Tomatoes occupy a unique position in Mediterranean cuisine and in nutritional research because of one specific compound, lycopene. This carotenoid has demonstrated powerful antioxidant effects, particularly protective against prostate cancer, cardiovascular disease, and skin damage from UV exposure. The research on lycopene and prostate cancer specifically is quite robust, but here's what makes tomatoes especially interesting. Cooking them actually increases lycopene bioavailability. This is counter to the usual recommendation to eat vegetables raw for maximum nutrition. With tomatoes, heat breaks down cell walls and makes the lycopene more accessible to our digestive system. This makes tomato sauce a nutritional superstar, not just a convenient cooking ingredient. The implementation is straightforward. Consume tomatoes daily in various forms. Fresh in salads with olive oil to enhance lycopene absorption. Cooked in sauces. Roasted as a side dish. Sun-dried for concentrated nutrition. As the base for soups and stews. Making large batches of tomato sauce with olive oil, garlic, and herbs gives you convenient, nutritious food for the week. The combination of tomatoes and olive oil is synergistic. The fats in olive oil enhance carotenoid absorption significantly. This isn't just traditional wisdom, it's demonstrable biochemistry. Choose the deepest red tomatoes for the highest lycopene content. Include tomato paste in your cooking. It's highly concentrated lycopene. Now for the reality check. Fresh tomatoes outside of peak season are often flavorless, mealy disappointments. They're picked unripe, shipped long distances, and bear little resemblance to what Mediterranean populations actually eat. The recommendation to choose canned tomatoes during winter months isn't settling for less. It's often nutritionally superior to off-season fresh tomatoes that were harvested before ripening. There are concerns about BPA and can linings, though many brands now use BPA-free cans or glass jars. The sodium content in canned tomatoes can be significant, which matters for people managing blood pressure. You can find low-sodium or no-salt added versions, but they're not always available or affordable. The acid in tomatoes can be problematic for people with acid reflux or GERD. Daily tomato consumption might exacerbate these conditions. For some people, nightshade vegetables including tomatoes trigger inflammatory responses or joint pain. Though the scientific evidence for this is limited and controversial, there's also the issue of variety and quality. Heirloom tomatoes at farmers' markets bear little resemblance to standard supermarket tomatoes in terms of flavor and likely nutrient density. But heirlooms cost significantly more and aren't available year-round in most locations. Despite these limitations, tomatoes exemplify a Mediterranean diet principle. Simple foods prepared well with quality fats create both nutritional value and satisfying flavor. The lycopene content, the vitamin C, the potassium, the folate, all of this in a food that's versatile, relatively affordable, and culturally familiar to most people. That combination of accessibility and evidence-based benefits is rare.